Hi, welcome to the channel. If we haven't met yet, my name is Todd. Been a home care nurse for almost 11 years in August. Um, Today, I'd like to talk to you about a request that came through on the comments asking for documentation tips for wound care. And there's some reasons why wound care documentation is important. It's just not about compliance, it's about continuity of care. Also for legal protection and proper reimbursement. Seems like we're always under the watchful eye of the insurance company. So if it's not documented, it's considered that it didn't happen, and that could, hurt the patient or even affect you as a nurse and your licensure. So it's important to do good documentation. Let's see here. The must-have wound elements to be in the document is the location, the size, the type of tissue, edges, exudate, and the wound skin. That's kind of the area around the wound, and the pain level, and then also um, the response of the treatment that's given when you've given it. Going back a little bit more about it. So location. So you want to be specific on, you know, not just foot, but saying right heel, or the size. It'll be always the first number is the length, and then the width, and then the depth, and it's always in centimeters. And the type of tissue, whether it's granulation or if it's slough or if it's eschar. Um, Eschar is more that black uh, hard tissue there, and slough is more of a whitish tissue, and then granulation's more of that beefy red type of color. But there's lots of YouTube channels showing how to do the more specifics in the wound care. Then the edges, whether they're open, rolled, or macerated, and for the exudate, it can be serous or it can be purulent, and the amount that there is, and then also the odor, if there's any. And then the skin around the wound, um, whether it's intact, if there's any redness, or any maceration, and that's kind of like the weeping of the skin. And the pain level that the patient might be experiencing with the wound, and we always document that between 0 and 10. And then also talking about the type of dressing that you put on the wound, and also the response to the treatment that you're giving. Is the wound getting better, or is the wound getting worse, or is it just kind of staying about the same? There's kind of a neat little acronym to help kind of remember all this, and it's called Let's Deep. LETSDEEP. So L for the location, E for exudate, T for tissue type, and S for the size, and then D for the dressing, E for edges, and another E for erythema, and that's around the peri wound if it's red or not, and then also the last one being P for pain. Using descriptive language is very helpful too. Um, just by saying that it looks bad is kind of vague, um, but using measurements and observable facts helps to give a better description, such as the wound bed is 50% granulated, or 50% slough, or no foul odor, or moderate serous drainage. So that gives more specifics. I think about this. If another nurse would, read your note, would they know exactly what the wound would look like and what to do next? Another thing is being consistent with the wound progress. You're measuring the wound the same way each time, and that's usually the first number is the length, and then we always follow 12 o'clock, 6 o'clock direction of the clock, straight up and down, and then the width being, left and right, and that's from the 3 o'clock to the 9 o'clock position. And your note should be showing improvement, worsening, or no change, and be honest, because faking on the progress note is not a good thing, because eventually it will catch up with you. So just being honest about it. Documenting education given. Did you teach the patient or caregiver about wound care? Infection, signs of infection, or dressing changes? How often are they, teach them, and how often that they would change the dressings? And then also include any kind of patient education on signs and symptoms of infection, and when to notify the nurse when things are not looking right. Also, in essence, good documentation protects your license and yourself. If something is unusual, or if the patient refuses the wound care, or if there's non-compliant, then it's good to document that and say that. For example, patient refused dressing change, stating it hurts too much, and explain the risks were explained to the patient, and the doctor being notified. And then the last part here, you know, take advantage of wound care templates. They really help you out. Many electronic medical records, known as EMRs, have built-in wound care flow sheets that kind of help out, and I use them a lot. And also, if your tablet will do that, adding free text summary to show critical thinking, and that's a little bit more advanced. But anyway, to wrap up this video, and I appreciate you getting this far through the video, and I hope that it's given you some value. If you would like any comments about this, I certainly would like them. I certainly don't know everything about wound care. I value people's opinions and trying to, throw out there the best content that I can to be helpful to new nurses in the home care field. But just as a wrap up for this, just double checking your wound notes before submitting them, and sometimes pictures. I know our tablet, we're able to document with pictures, and we do this once a week on Mondays to document the progress of the wound. And so anyway, um, just remember that you're just not documenting a wound, you're documenting your judgment and your care and your accountability as a nurse. And I appreciate nurses that are entering into the home care field. I'm going to do everything I can, not only for a nurse to survive, but to actually survive in the home care field, because we certainly need you, because people are jumping ship left and right. And so I'm trying to do my bit to help the profession out, keep people in the field, and provide good care for the patients that you take care of. Thanks for stopping by, and we'll see you on the next one.